Welcome to Medical Marijuana and Wellness. Tonight's topic is managing arthritis with medical cannabis. We're specifically going to also talk about medical cannabis joint pain. Now, I do want to point out arthritis is something that a lot of people have. I know I do. It's very disturbing and it does get in the way of my lifestyle. And I found that medical cannabis has at least helped me to be able to get some of my life back and to reduce a lot of the inflammation and the pain from arthritis. So tonight we're going to jump into arthritis, what it is, how it works, and different ways you can use medical cannabis to help you. And I do want to point out that this webinar is being put together for education and also for information purposes. If you need any medical advice, please contact your doctor, your medical marijuana doctor, or your medical marijuana practitioner. And I should also point out, during the webinar, we will be answering questions prior to I'm going to play a video. And right after the video, what I will do is we'll answer the questions you submitted prior to the webinar. And then after that, we'll answer any questions you submit during the webinar. And how you submit those is by hitting the little Q&A button that's at the bottom of your screen. So I hope to give you some information about medical cannabis that can help you. We'll have a short video. And then again, please feel free to ask any questions that you might have. It's a good opportunity to be able to help you be able to understand how to use medical marijuana for your condition. So let's jump into the video. Welcome to Medical Marijuana and Wellness. Today's topic is managing arthritis joint pain with medical cannabis. And I should point out that this presentation is for educational purposes only. If you need any medical advice, diagnosis, or treatment, please get a hold of your medical doctor, medical marijuana doctor, or your medical marijuana practitioner. I want to point out that this video is part of a group of videos that we put together on our YouTube channel, YouTube/@marijuanaaware, to help you address your medical condition. You may want to check out Understanding Cannabis as Medicine, Smarter Cannabis Dosing for Reliable Relief, Your Terpene Toolbox, and Cannabis Medibles. So what is arthritis? Arthritis is the inflammation of joints connecting two bones, such as fingers, hips, and ankles. What are the typical symptoms? Well, joint pain, inflammation, minor swelling, and sensations of heat. And also this is the underlying condition for fibromyalgia, systematic lupus, and also other injuries to the joint. So the common types of arthritis are osteoarthritis, referred to as OA, and this is characterized by a breakdown in the cartilage in the joints, typically the hands, hips, knees, and spine. There's also rheumatoid arthritis, referred to as RA, and this is a serious inflammation of the joint's interior lining. This causes a lot of pain, permanent joint damage, and disability. So medical marijuana and arthritis. What can and can't it do? Well, first of all, cannabis cannot cure it. It's not going to reverse the cartilage depletion, nor will it cause any fatal overdose. It's important to point out no one has ever died from the use of cannabis, both recreationally and also medically. So it's safe. What cannabis can do is reduce your level of pain, reduce your inflammation and the pain associated with the inflammation, improve your overall health, and help you with your stress and anxiety. So what do the research and studies tell us about cannabis and arthritis? Well, first of all, the Arthritis Foundation found out that 79% of the patients surveyed were currently using CBD. 71% of the patients found out that it helped them with their ability to sleep. 94% of the patients found out it relieved their pain. 67% found out that it helped them with their mental health and depression and mood. And 66% of the patients were talking about their doctors about the use of CBD. So Harvard Medical School tells us that 9 out of 10 patients have effectively used cannabis in order to manage their pain. 4 out of 10 patients have found that it decreased their reliance on other medications, and 6 out of 10 said that cannabis products were more effective in addressing arthritis than any other drug. The Journal of Cannabis Research published an article by the Institute of Cannabis Research. What this found out was that researchers using CBD found out that 83% of the patients found it helped them with their pain, 66% of the patients found out it helped them with their physical functions, and 66% of the patients found out it helped them with their sleep quality. So the question is, what types of medical marijuana products should we use to address arthritis? Well, first of all, looking at the symptoms, which are joint pain, inflammation, swelling, and heat sensations, we find that there are 4 primary terpenes that can address this. That's pinene, linalool, myrcene, and caryophyllene. These are very effective at managing arthritis. And what you might want to do is when you go to the dispensary, talk to your bud tender, ask him for a certificate analysis, and he'll be able to identify the terpenes that are in the products that you're looking for. Also, when you're looking at whole plant products, which are products that contain all of the terpenes, you might want to take a look at the rosins, resin, and RSO products. So what are our options for taking medical cannabis for arthritis? Well, typically there's a rule of thumb. Fastest in is the fastest out. What they're referring to is the average onset time and also the average duration. And an example of that is a topical. A topical will typically have a 1 to 10 minute onset time, but only a duration between 1 to 2 hours. But I do want to point out that for arthritis, topical products are highly effective and I highly recommend them. Now, an exception to this rule are what they call transdermal patches. And that's because they have an onset time of between 1 to 10 minutes, but they're engineered to have a duration time of anywhere between 8 to 72 hours because they're using a microdosing formula. And I highly recommend these products as well. You'll find they'll help you with your relief, both for pain and inflammation. Other products I look at to be able to get immediate relief: concentrates, vapes, and flour. Now, if I'm looking for something to last a little bit longer, I want to take a look at things like sublingual drops or tinctures and sprays. They typically have an onset time of between 15 minutes to 20 minutes and also a duration of between 4 to 6 hours. And I should point out they take their full effect in about 30 to 60 minutes. If I'm looking for overnight relief or longer relief, I'm looking at capsules and edibles. These typically have a 20-minute to 2-hour onset time and a 4 to 10-hour duration time. Now, why do edibles have a faster onset time? Because a lot of edibles today are being engineered so that they're being made with what they call transdermal products, meaning they're making products that will react faster and be able to be absorbed into your system much quicker than the typical cannabis products. And this is where you want to be able to plan accordingly to make sure that you're getting not only the immediate relief that you're looking for, the time of the relief that you're looking for, but also you make sure that you have the full duration time that covers your particular situation. Now, I know this slide is a little bit difficult for you to see on your screen, and it will be included in the package that we send to you as a follow-up to this webinar. But I do want to point out the products you can find from a dispensary that are targeted for arthritis relief. In this particular case, we're looking at products from Air dispensaries, and it's a range of products from the vapes, chewable products or edibles, tinctures, and also RSO products. And you'll see that there's a rich amount of terpenes in each of these products that do address your condition, which is arthritis. And when you go into your dispensary, please go in and tell your dispensary of the different terpenes that you're looking for and your particular condition. They'll be able to guide you to the products that you're comfortable using and one that you're most familiar with. Now, we've talked a lot about medical cannabis and also arthritis. And let's take a look at some of the bottom line issues here. First of all, there have been no reported overdoses from the use of cannabis, either medically or recreationally. And this is very, very important because cannabis is a very safe product when you compare it to a lot of other alternatives like pharma drugs. Cannabis has no addictive properties, unlike opioids and tobacco. You don't need to smoke it to get the benefits of cannabis. And also, used correctly, medical cannabis will not get you high and also will not have any uncontrollable high. You are in control of the whole process. The most important part is you have an option and some products that can help you get your life back by using medical marijuana. Well, I hope that provided some information that gives you some guidelines to be able to use medical cannabis for your arthritic condition. Again, pay attention to the terpene profile. That's very, very important. And when you go to your dispensary, don't forget to talk to your bud tender. Give them that terpene profile. Tell them you're managing arthritis, which you're looking for something that addresses pain and inflammation. And I'm sure they'll have a number of products that can really help you. And as we pointed out by showing the Air dispensary range of products, there are a number of products that can be used and a route of administration that you're comfortable with. So that being said, why don't we jump into some of the questions that you submitted prior to the webinar? So first of all, the first question is, would a 50-50 THC CBD hybrid be effective for joint pain without the high? And the answer is yes. That's referred to, the 50-50 is referred to a 1-to-1 product. And by the way, when they're talking about these ratios, like 1-to-1 or 1-to-4 or whatever, the first number is CBD and the second number is THC, just for your information. So the answer is yes. In fact, that's what I highly recommend when you start your regime to address arthritis. Now, it's important to point out that you need to go through a process where you're going to do some dosing to find out what your sweet spot is, because it's not a matter of just taking the product. You want to be able to know what your tolerance is for it, for example, THC. That can help quite a bit. But the answer is yes, it's very, very effective. Now, in certain cases, some people will take a look at products that have a higher ratio of CBD. In other words, they'll have a product that might be a 4-to-1, meaning 4 CBD to 1 THC. Some people use a 9-to-1 CBD to THC. Again, this just depends on your particular condition, your body, and your tolerance to THC. But again, 1-to-1 is a very effective way to start. I would recommend going low and going slow. We always do that. And then again, try that for a day or two. And if that doesn't work, up your dosing, the amount you're taking, add a little bit more and go from there. But the answer is yes, it will. And I highly recommend that's a great place to start to be able to address your arthritic condition. The other thing you might want to pay attention to is not just a tincture, but also you may want to pay attention to using some topicals. They can help you quite a bit with arthritis. Let's jump into the second question. Does the THC type impact results, e.g., Delta 9, Delta 8, flower versus gummy? Well, let's separate two different things. Let's separate route of administration from the actual cannabinoids themselves, because that's a dual part question that you've asked here. First of all, when you said the type of THC, we're mainly referring to both Delta 9 and the products also that are being made also have a slight amount of the Delta 8. Delta 8 is not as popular or as populous inside the cannabis plant as Delta 9, but it is still there. I would highly recommend using a Delta 9 product over a Delta 8 product, primarily because Delta 9 is stronger. It has better medical relief, and also it's faster acting than Delta 8. Delta 8, you need to take a little bit more, in fact, quite a bit more in order to be able to get the same results as Delta 9. So the answer is don't waste your time. Just go right to a Delta 9 based product. If you buy a product from a dispensary, it'll probably have both Delta 9 and Delta 8 in it, but the primary THC product you're looking for is Delta 9. And more importantly, make sure that that product has CBD in it. Using CBD with Delta 9, using CBD with THC creates what they call the entourage effect. What that means is that both of them together work better than by themselves. And so by being able to do that, you'll get more from the product. You get better results if you're using a little bit of THC and CBD in your THC. That should help you quite a bit. Now, flower versus gummy. Boy, that's two different ends of the spectrum here. Flower is something that you light a joint, you smoke it. You can either smoke a joint, you can use a dry herb vaporizer, or you can vape. That's one way of going. Let me talk about that one for a second. If you're using flower and you're using a blunt, where you can use a joint, and you go to fire up and you go to light that joint, that 550-degree flame that you're putting up to that joint will burn off most of the cannabinoids, almost all the terpenes, and almost all the flavonoids. So you're reducing the medical efficacy of a joint down about 50 or 60%, and that's the bad news. Good news is it still works. Thing is, you just have to smoke more of it to be able to get the same effect that you would get from using a tincture or, say, for example, for a gummy. Now, dry herb vaporizer, completely different story. In that particular case, what you're doing is you're taking the flower, putting it into a little bit of a pod. You're steaming that particular pod, which means you're getting away from the carcinogens that you would get with a blunt. So it's much safer for you from the standpoint of how healthier, it's much healthier it is for your lungs. Although anytime you put anything in your lungs, you do have to be careful. But this is a much more healthier way to go. And also the other key is when you vape, you can actually set the temperature that you want for that particular product or that particular flower. In other words, if you set a temperature of about 356 degrees, you'll get the beta-caryophyllines, you get the myrcenes, you get most of the cannabinoids. In fact, you get all the cannabinoids that you want to address arthritis by being able to set that 350, 356 degree with your dry herb vaporizer. Now, vape pens, when you buy them at your dispensary, they either have no setting at all, and if they have no setting at all, they're set to high. So I don't recommend using them for arthritis. But if you do buy one you can buy one that has 3 different settings, low, medium, and high. I recommend using the medium setting. That medium setting is equivalent to looking at the 350 degree, 356 degree temperature, and that should help quite a bit. Now, that has an onset time of almost immediately, within a minute or two. It'll last anywhere between 1 to 3 hours, depending on your metabolism and also your tolerance to THC. And now also, gummies, completely different thing. Gummies don't work immediately. Gummies take usually 30 minutes and up to potentially 2 hours to work. So they have a longer onset time. However, they have a great duration time, meaning they will last anywhere between 4, sometimes 6 to 10 hours, which really helps you with things like if I need to sleep overnight and need to get some rest, I'm trying to do something, let's say during the day where I need to be able to address my pain and inflammation, or if I just want to have a chill out evening, it really helps quite a bit. So it really doesn't make any difference if you're using flower, gummies, or candidly tinctures or anything else. Stick to a product that has not only THC, meaning Delta 9, and one that also has CBD in it. Very, very important. For arthritis, make sure it's a product that does have CBD and THC together, because that CBD does wonders to be able to help you with your arthritic condition. I think we had a slide on CBD during the deck, and it really brings up the point that that neuroprotective capability is really, really important. Let's talk about the next question. How do I properly use a topical for arthritic joint pains on my hands? That's a great question because there's a couple of different topicals that you'll find when you go to a dispensary. The first one you'll find is like a cream, and then the other ones you find are like a balm. What you may want to do is, for example, I have arthritis in my hands, and I type all day. I'm using keyboard, so I want to be able to keep my pain down and keep my flexibility. What I do is I typically take it and I rub it into not the back of the hand, but also rub it into the joints. In other words, the joints where I'm having the arthritic pain. And in my case, I do have some arthritis that extends out to my fingers, the joints in my fingers. So what I'll do is I'll just take my time. I'm not trying to just throw this on. I'll rub it in, make sure it's rubbed, it's there. I'll rub it not only on the joints, the back of my hand, I'll then do it to the fingers, and then I'll turn it over and do the same thing on the other side and rub it into my palms itself. What I'm trying to do is I'm trying to coat essentially my whole hand. Now, it's easier to do with a lotion, no question about that. It's more liquid and easily more viscous. Balms, however, work very, very effectively. In fact, I find in many cases the balms work a little bit better than the viscous liquid type of or cream type of topicals. And again, that's just a process of rubbing it in. Again, when you use a balm, you have to rub it in a little bit more. But again, what you're trying to do is coat the entire hand. If you have a problem, let's say with your middle finger, it may also be tied to something that's going on with your thumb or with your little finger. So that's why you want to coat the whole hand so that you're covering the whole range of nerves and nerve endings that you have to be able to address it, not only because of inflammation, but also for pain. If you reduce the inflammation in your hands, it will reduce the pain, and that's what you're trying to accomplish with the topical. I hope that helps answer that question. Is it better to use a cream for joints or edibles? Well, candidly, I'd recommend using both. And the reason for that is that creams for joint pain work almost immediately. You put that on. I've noticed that, like, for example, when I have joint pain, I'll put it on, and literally within 5 minutes, my joint pain will be less, if not completely gone. I think that's very, very important. But that only lasts for about an hour or two, max 3 hours, max. I mean, usually it's about an hour to an hour and a half. Edibles, on the other side of the coin, not only work longer, but they are also very effective because I can get a 1-to-1 or I can get a ratioed edible that has a lot of the tinctures that we're looking for that helps me quite a bit. That will last me from 4 to 10 hours, and that helps quite a bit. And if you have a high tolerance to THC, or if you've done your dosing where you know what your tolerance level is, a lot of people can use a 1-to-1 or a 2-to-1, meaning 2 CBD to 1 THC edible during the day to help them with their joint pain without necessarily getting high. But that's a process of going through your dosing regime and knowing what your tolerance is to medical cannabis. So I'm not going to pick one versus the other. One, the joint pain, if I use the cream right away, it works right away, and it helps me quite a bit, which is really what I'm looking for. But if I want to get rid of my joint pain for the morning, potentially into the afternoon, then I'm looking for something else like an edible and or a tincture. And I hope that helps with that. That's going to give you the longer duration that's really out there. You don't want to keep putting topicals on your hands every 2 to 3 hours all day. That's kind of a tough process to go through. Let's jump into the next question. Uh, what we what we give immediate what will give immediate pain relief for multiple areas to reduce inflammation? Well, I would say really taking a look at two different things. One is your topicals. They help quite a bit. That'll help you get rid of that pain right away. The second is I would take a look at whatever the route of administration that works right away for you is, and that might be something like if again for immediate pain relief, I'd look at something like a dryer vaporizer or a vape pen that you can set the temperature on. Both of those will help like right away with joint pain. I My arthritis is a problem. My main problem is pain in my neck because I have 7 herniated discs in my neck, which is very painful. I find that if I use a dryer vaporizer pen in the morning or a vape pen, I find I get rid of my pain. It addresses that pain literally within a minute or two, and it'll last in my case, between about an hour and a half to 2 hours. So I'd say take a look at vape pens or topicals. They'll both help you with relieve that pain right away. Let's run into the next question. It says, since I don't have a gallbladder, edibles are ineffective. Tinctures don't seem to last through the night. What should I do? What should I be using? Well, What's interesting is when you're taking a look at the duration, that goes, you're following normally this chart that's over here. Now, without a gallbladder, it's going to have a different, you're metabolizing things differently. So this is an important process where you have to go through your process where you're going to go do your dosing, find out what your sweet spot is. I would say start with something low, and go slow. Initially, what I would do in your condition, with your position, with your condition, is I would start with a tincture. And then what I do is I take a tincture that is higher in CBD than THC. So I get a tincture that's a 2-to-1 or maybe a 4-to-1, and I'd use that. And again, understand that onset for that is going to be somewhere a little bit longer. That onset is going to be 20 minutes, 15 minutes, 20 minutes, but it lasts between 4 to 6 hours. That might help you. That's there. They won't last through the night. They're not designed to last through the night. What's designed to last through the night is the edibles, okay, and also the edibles that are there, and also some of the capsules. One of the things you might want to try, and again, this goes back to just finding out what your body can tolerate and can't tolerate. You might try an RSO capsule. That's something. Now, be careful because RSO is very strong. But I think we showed you some RSO capsules that were in the Air product catalog. They might be able to, you might be able to get your body to ingest or be able to convert that capsule into hydroxy 11, which is what you're looking for to get that pain relief that lasts anywhere between 4 to 10 hours. So I'd take a look at experimenting with different, how should I say, products to be able to see if that works. Again, edibles, a lot of edibles that are made are transdermal. They're doing different things. You may not be able to absorb them like other products, but I try a capsule, and if the capsules and edibles don't work, you're kind of stuck with, unfortunately, you're kind of stuck with using things like tinctures, which can last for 4 to 6 hours, and that might be able to help you quite a bit. Also, pay a lot of attention to the terpene profiles because this myrcene, linalool, terpenoline, all of those are made for and designed to help you with they have the analgesic capability, they have the capability to help you with inflammation, and they also have the capability to help you with, they're also sedative. So that can help you quite a bit. And I say pay attention to that when you go into your dispensary. Talk to them, tell them about your condition, tell them about your gallbladder situation, and then have them give you some products with this terpene profile that can help you that's out there. Because half of the battle is the length of time this takes to work. The other half battle is making sure you have the right product that you're using, and that might have something that's there. Again, I would go through a process just like I'm dosing. I'd go low and go slow and build up and see what actually works because your body is going to react to something. The question is, what is that? And unfortunately, you're going to have to experiment with that a little bit, but it's not going to take you very long. It'll take you about a week or two, and you'll be able to hopefully home in on a product that can help you with your medical cannabis. I hope that helps quite a bit. Let's see what's there. Let's look at the next question that's there. Or a question from the audience that comes up. Can you mix and match? For instance, can you use topical products along with edibles? Heidi, absolutely. In fact, in my regime during the day, I use, when I get up in the morning, I use a vape pen. I hit a vape pen right away because I have herniated discs in my back. I have bad knees. I'm an old guy. I'm a senior citizen. So I've got all of the things from artificial knees and herniated discs and all this stuff. I hit a vape pen. And literally, within a minute or two, my pain level drops down to below 1. But it's only going to stay there for an hour or two. So that's when I use a tincture right after that. And then what I'll use like an edible in the afternoon, or I'll use another tincture. It just depends on what I'm planning to do, what that work schedule is that day, what I'm planning to do, the workouts I'm planning, and that type of thing. But mixing and matching your routes of administration absolutely work. In fact, you have to do that to be able to get a regime that'll cover your 24-hour-a-day time period. So I hope that really helps. And don't be afraid to mix and match. And again, you can talk to your dispensary. Your bud tender will help you figure out the right products that you can use. Other question is, how effective is cannabis in treating goatee arthritis for both prevention and any flare-up treatments? Well, first of all, what cannabis does is it reduces the inflammation. That's the process that causes a lot of the pain in arthritis. When you get that inflammation, it causes pain. By reducing the inflammation, it brings that down. Naturally, you want to have something in there to address the pain, but if you can get rid of the cause of the pain, which is the inflammation, you're going to go a long way towards, again, getting the relief that you may want to that you may want to take a look at. Now, I would recommend a cannabis product, especially the topicals. I'd recommend the tinctures, and then again, edibles might help quite a bit. I know that I have a magic brownie that I make at night, and it really helps me not only get my sleep, but it also helps me get rid of a lot of the aches and pains that I have in my body, and it really helps. Really, that's there. So the answer is yes. As you saw from the studies that were done, cannabis is very effective for arthritis. And again, a lot of that has to do with attacking the inflammation. And the condition that you have is one that does have a unique type of inflammation, but it still is inflammation. And cannabis will work very effectively to help you with that. And you might give it a try. My godmother had arthritis. She was terrible. She almost couldn't open her hand. And I started working with her, put her on on a regime of medical cannabis, and literally within a month, she was able to go back to a routine that was very close to what she did before, where she had a closed hand, she couldn't use a remote control and had trouble eating. She now could use her fingers. She was knitting again. She was baking again, which I love because she was making me. She makes some she makes some great stuff. But I'm saying the answer is yes. I would pay attention to a CBD THC based product that can help you quite a bit. I hope that really helps. As far as the flare-ups, if you have CBD in your system, what it does is it counteracts and goes after those inflammation flare-ups, which is what causes a lot of that pain. So that's something you might want to take a look at. The answer is the more CBD that you use, the more it builds up in your body, the more it'll help address the flare-ups that you're really looking for. Other question is, do you ever do it? You ever do a show on eating or drinking flower and the process? Keith, that's a really good question, and it's one that the answer to your question is we have not done one in the past, but it's in the hopper right now. We are working on some videos. I'm working on some videos with the team, and what we're looking at doing is putting together how do you take tinctures, how do you take edibles, how do you take flower, that type of thing. So the answer is yes. We're going through a process. We're going to physically in a video not only show you how to do it, but I have some practitioners that are going to help me, Nurse Amy and a few other people that will show you how to do that. It takes a little bit more time to be able to produce those. That's why we just didn't pop them right out because we want to do a quality job on that. But the answer is yes. I think that's something. Keith, you brought up a good question, and thank you very much for bringing it up. We think it's something that's really important to take a look at. So hopefully we've answered all your questions. If there's any more, please feel free to bring up any questions. I do want to mention that this webinar has really been designed to help you get your life back. We really want to make sure that you get the information that you need. The more you learn about medical cannabis, the more you're going to be able to not only address your condition, but also be able to relieve the pain and inflammation. And I think that's important when people are trying to address this particular condition. So first of all, I want to thank everybody for joining me tonight. I know it's been a bit of a long video, but hopefully it'll give you the information you need. Please check out our YouTube channel, Marijuana Aware, and that can help you get not only this video, but other videos in the future. And then also, if you're looking for a medical marijuana card, please check out the MMTC, Medical Marijuana Treatment Clinics of Florida. That's MFTCFFL. They do a great job of not only getting you the card, but they have a support system after you get the card to walk you through your medical cannabis process, both by email and having an online call center that can help you be able to really not only use medical cannabis effectively, but also use it cost effectively. If you're looking for great medical marijuana products, I recommend AIR. They have a very broad range of quality products. They're very quality conscious, and also they do a great job of educating their staff, both their bud tenders and also their people that are there to help you with this particular condition. And last but not least, I want to point out that we have some other videos coming up. We have neuropathy next week. They're going to have a weight loss at the end of the quarter. And then next quarter, we'll have another set of videos. Keith, we might be addressing your question at that particular time. And I want to thank you very much, everybody, for joining me. I want to thank a couple of folks in the background that have made this whole process, this whole webinar, and this whole video make it happen. And that's Lee and Leah. Thank you very much. You have a great job. I look to seeing you next week for neuropathy. And I want to thank you very much. And hopefully, we'll help you address